Now we're talking about another very important topic in radiography, and this is the topic of motion and its control in radiography. Motion and its control in radiography. So for motion and its control in radiography, you just have to do it. You giving instructions to the patient that, okay, move this way, and you trying to avoid unnecessary movement in the patient that could actually interfere with the quality of the image you are trying to get. So motion in radiography just refers to any patient or organ movement during exposure, okay? And if you are instructing the patient to do it, it's for your own good, right? To get good images. But if the patient is doing it without your instruction, it could actually lead to you having a blur image, lots of details on the image, and you have more cases of you did an image but it wasn't clear, so you have to still do it again, thereby exposing the patient to more radiation. So types of motion in radiography we have voluntary movement, where the patient has to breathe and talk, all right? Involuntary movement, things like heartbeat, peristalsis, tremors. Equipment related motion, that's movement of those x-rays and all of that, right? So patient could move, also the machines could move. So you have to ensure that that movement is within your control to ensure that the images are always clear, So if it is moving without your control, the images are usually blur, and you have more cases of you have imaged the patient but you have to also still image them again. So methods of motion control include patient communication and cooperation. So clear instructions before exposure, hold your breath. Demonstrating positions to reduce anxiety and improve compliance. Using simple language. If you are dealing with children or elderly people, you know that these are the extreme ages, so you have to actually explain everything in detail. So immobilization techniques, where you use all those physical support. Then if it is a child, you make sure that maybe their parent is there so that everything is not that all strange to them. So exposure adjustment, so short exposure time reduce the chances of motion blur. So make sure that the patient is well arranged so that you just take the image once and for all. So specialized technique, when you're ready to image, you can tell the patient to breathe in or breathe out and hold it. Then you image and they continue with their normal life. Okay, so I think that's what we got for this consideration in radiography.